So that means the filaggrin gene actually maintain the barrier of the skin. If this eczema or atopic dermatitis is again surrounded by any secondary bacterial or viral infection, then one important complication will arrive. The name is eczema herpeticum. So treatment is first emollient. Second one is topical steroid. See, I want to show you the picture, okay? Eczematous child. See, atopic dermatitis, inflamed skin, worsened by rubbing. Very important. Actually, I'm mentioning this because they give you the exam the same picture and ask you the things they have written in this area. Atopic dermatitis, inflamed skin, worsened by rubbing and scratching. That means the child is playful or toxic? Too much toxic. So the child child is too much toxic. Suppose the child is normal, playful, smiley face, but having so many rashes. Is this eczema? No, not at all. So this is, each is the key. See, each is the key clinical feature in eczema at all ages. Don't forget about these things, okay? Forget about your everything, but don't forget some lines before our exam. Each is the key clinical feature in eczema at all ages, leading to an itch, scratch, itch cycle. Very important. So no itch, that means then it is not eczema. Okay, no itch, that means it's not eczema. Now what are the name of some itchy rashes? This is very important for your exam as well as for your clinical practice. So suppose the child came to us with rashes, with itching. So the things what should be came in our mind, right? I'm seeing that a patient coming to us, so many rashes with itching, few intensive itching. So these 4 or 5 DD actually should come in my mind, right? First thing is, say, atopic eczema. Second is chicken pox. Third one is urticaria or allergic reaction. Fourth one is contact dermatitis. Fifth one is insect bite, scabies, fungal infection, and pityriasis rosea. Okay. Now we will read important, extremely important. If Mrcpch will give one questions from dermatology, they will give the eczema or eczema herpeticum or atopic dermatitis. They will give this, actually touch these topics. Okay, so let's start with that. I will tell you from the book, but prior to that I want to tell you something. See, eczema or atopic dermatitis, okay, there is one genetic deficiency. I don't know how actually I am expressing this. This is important. So eczema or atopic dermatitis or something else. Okay. So number 1, there is a genetic deficiency of one gene, that is filaggrin gene. Very important. Filaggrin genes. So what is the function of these filaggrin genes? Now, if the deficiency of filaggrin gene can do the poor barrier function of the skin, so that means the filaggrin gene actually maintain the barrier of the skin. So when it is absent, the genetic deficiency of filaggrin gene, so there is poor barrier of skin, right? So poor barrier of skin means everything can come, go and out. If your house has no door, so everyone is coming into a house and come out from the house. So there is a poor barrier of skin, so that means everything can go and out, and that causes eczema. Asthma. Asthma. Now, another important factor that is related to asthma, one is eczema. We have found from the dermatology, right? Another thing is obesity is also, and from the neonatology, I told you that the non-breastfeed or formula feed also developed not asthma, but they actually developed the respiratory problem. Okay, so these are the involved condition. Okay. Now, what are the clinical features of eczema? There is a dry, itchy skin leads to scratching. How the child present to you? Dry, itchy skin leads to scratching and exacerbation of the rash. Dry, itchy skin. Suppose your skin is so dry, so you have to itch them, right? Itching. So whenever there is a skin is too dry, it will lead to scratching and exacerbation. When you will continuously scratching your skin, there is a exacerbation of rash. Okay, exacerbation of rashes. It may be now coming the extremely important things. This eczema or atopic dermatitis, okay, it may be complicated by the secondary bacterial infection or viral infection, but the most common complication is eczema herpeticum. If this eczema or atopic dermatitis is again surrounded by any secondary bacterial or viral infection, then one important complication will arrive. Name is eczema herpeticum. Okay, eczema herpeticum. Eczema herpeticum, there is an extensive vesicular lesion. I will tell you the scenario where actually the Mrcpch will give you the scenario of eczema herpeticum. But before that, I want to tell you that this is if associated with secondary bacterial or viral infection, then it is known as eczema herpeticum. Okay. Now this eczema herpeticum having extensive vesicular lesion. Extensive vesicular lesion. Okay. Extensive vesicular lesion. So this is the eczema herpeticum, which is a complication of eczema or atopic dermatitis. Okay, now management. Now management is first one, avoidance of allergens and dietary elimination of the substance that exacerbate it. Number one, avoidance of allergens plus dietary elimination of substance that is allergic. Okay. Number two is, first of all, we will give the emollient, right? Then topical steroid. Okay. If the baby, suppose we will give the, now tell me, suppose we will give the emollient, the baby is not responding. After that we will give the topical steroid, right? Topical steroid, after giving the topical steroid, the child is still not responding. Then what will you want to do? After that we will give topical tacrolimus. Okay, topical tacrolimus. Tacrolimus, as far I remember, it's a calcineurin inhibitor, right? So if I want to give topical tacrolimus ointment, I have to see the age of the child. If the child is more than 2 years, not less than, if the child age is more than 2 years, then only we can give the topical tacrolimus after the topical steroid. First of all, so treatment is first emollient. Second one is topical steroid. First, low dose topical steroid. Suppose the low dose topical steroid not responding. After that, we can give the high dose topical steroid. Okay, even instead of giving the high dose, the child is not responding. After that, we will give the child age is more than 2, suppose 3 to 4 years old child, then we will give the topical tacrolimus. After that child is still not responding, then we will give oral acyclovir. If it is viral cause or if it is bacterial cause, then we will give the supportive management. Okay, but most commonly they actually give the viral scenario. Okay.